So you can use a blood pressure cuff to assess strength, and this is something that the doctor can order. It's not something that you would do on your own, but it's kind of fun to look at. So you roll up a blood pressure cuff and you have the patient hold it in one hand. You inflate the cuff to about 20 mmHgs of pressure, and then you lock the valve. Then ask the patient to squeeze the cuff as tightly as possible. And you note the increase in the pressure on the dial. So a normal grid registers above 150 mmHgs. You record the hand tested and the results of the test, and then repeat on the other hand. So you can use the blood pressure cuff to compare the grip of the right hand with the grip of the left hand. Kind of cool. Radiology and diagnostic imaging are frequently used to help diagnose orthopedic conditions. X-ray evaluation is necessary to diagnose fractures, dislocations, bone and joint diseases accurately and to track healing. It's important, as with anything we do, to explain all procedures to the patient in a professional and empathetic manner. How do you think you should handle questions from patients about whether certain procedures are painful? We've talked a lot about this, that we have to be honest to our patients. So patients are always concerned about whether a procedure will hurt. So we have to tell the truth. If the procedure is painful, let the patient know that so he or she can prepare for it. Most painful procedures are performed only after the patient has been given a mild sedative. So this is helpful. And then especially explaining the procedure to them so that they understand what to expect and how long the procedure takes, and kind of they're able to mentally prepare for it. Here is a reading of a lumbar radiograph, and you can find this in your book on page in figure 1916. If the patient wants to talk to the provider about the test, make sure that this happens. Make sure that you schedule a time for them to talk. Not just, even if it's within normal limits, a lot of times you'll just get either through your email portal or a call saying that all your tests were within normal limits, but sometimes the patient still wants to discuss with the doctor. So it's our job to make sure that we set that up. So specialized imaging techniques, we have the arthrogram, we have bone scan, we have dual energy x-ray, we have CT scans, we have EMG or nerve conduction velocity studies, and biopsy of bone and muscle. These techniques are used to diagnose and test for specific conditions. And you can find modalities here of heat and cold and the effects of heat and cold application in table 19.4. Physical treatment methods called modalities often are used in the orthopedic, chiropractic, and physical therapy offices to treat orthopedic conditions. So take a look when you get a chance at the heat, and heat causes the vasodilation and cold is vasoconstriction. And look more into this in your book and take some notes. So the general principles of cold application is cold application acts as a vasoconstrictor and causes goosebumps. It reduces blood supply to the area, and it basically causes a numbing effect. This helps to control bleeding, prevent further swelling and inflammation, and it also helps to reduce pain because of that numbing effect. Disposable, reusable, or homemade ice packs are most commonly used for cold application. We talked earlier about the bag of peas that can be very helpful. And then also you have a procedure, 19.1 in your book, and this is how to assist the provider with patient care by assisting with cold applications, and you need to take detailed notes on this. Heat modality, as we said before, Heat is a vasodilator, which increases circulation. It accelerates inflammatory process. It promotes drainage. It reduces swelling, relaxes muscles, and repairs tissues and cells. It's important to use with caution to prevent overheating and burning of surface tissue, especially like in the back area. You could put a heating pad on your back and not realize that, because our nerves are not as strong in certain areas, that it is actually causing burning and overheating. And contraindicated in certain circumstances, so sometimes we don't want that vasodilation, and so we only do the cold application. Body parts may be safely heated to about 110 without any tissue damage. Over that, we are going to see tissue damage. And dry heat therapies include heating pads, infrared radiation lamps, ultraviolet radiation, and hot water bottles. Let's talk a little bit about paraffin wax. This is a wonderful thing and used in treatment. Paraffin, it's a paraffin bath, basically. It's especially useful because it's treating chronic joint inflammation. You're able to dip the hand or whatever, you can even do it with feet and ankles, into the paraffin wax and let it sit, and this is able to get that heat really into the area. It's a mixture of 7 parts paraffin and 1 part mineral oil, and it is melted and heated to approximately 125 degrees Fahrenheit. The body part, which we said is usually the hand, but can be an elbow or foot as well, is dipped into the warm paraffin wax and then removed immediately. This leaves that thin coat that you can see here. There's a thin coating on the skin, and then it's usually wrapped in plastic or put in a little plastic bag and a towel to allow the heat to penetrate the tissue. And the paraffin is typically kept on for about 30 minutes and then peeled off. You want to tell the patient to use caution with home hot water bottles, as they can easily burn skin. So again, we want to educate patient with any kind of heat therapy about overheating and burning skin. Heating pads. Heating pads can be a wonderful thing, but they can also be dangerous for a patient who has experienced a stroke or are taking medications for pain or sleep. And precautions, as well as what I talked about in the previous slide, that heating pads can cause severe burns in areas if left on in areas where our nerves are not as strong in sensation. Some precautions to take: inspect the heating pad before use, keep the removable cover on, place the heating pad on top of the body part that's needed for heat, unplug the heating pad when not in use, read and follow all manufacturer's instructions, never use on an infant, and do not leave in a place longer than 30 minutes. So if you're, say, putting it on your knee, 30 minutes is the maximum at one time, because prolonged use in one area can cause severe burns. Therapeutic ultrasonography. The ultrasound transducer is placed on the body and vibrations are passed into the tissue. Ultrasound waves cause the tissue to vibrate, generating heat as they penetrate superficial tissue, and this speeds up circulation to the area. Have you ever had this done? It's wonderful. My chiropractor does it, and it does really help reduce inflammation and pain, and it can reduce pain and increase rate of collagen synthesis, and this promotes the healing in the area. Ultrasound is the energy carried by a very high frequency sound wave, or multiple sound waves actually. Massage and exercise. So massage is the systematic therapeutic stroking or kneading of the body or body part. It can relieve or reduce the body's localized and referred pain. Exercise is used to aid muscle relaxation, promote healing, and provide relief from tension and pain. Both active and passive exercise techniques may be used to keep body parts limber. What is the difference between active and passive exercise? So in active exercise, the patient initiates and controls movement of a particular part of the body. In passive exercise, the therapist moves the body part without the voluntary action of the patient. electrical muscle stimulation. This is low voltage machine and it creates a controlled electrical current, and this is applied to the patient through these little disposable gel electrodes. The transcutaneous electrical nerve stimulation, or also known as TENS, unit sends as a controlled electrical current to the skin. So this goes through and it actually contracts the area, so it helps relieve pain. It can help relieve pain caused by arthritis, back injuries, sports injuries, etc. What type of effects does the electrical muscle stimulation have? So this stimulation provides a passive means of exercising a muscle when a patient cannot activate that muscle voluntarily. And so if you've ever had this done, when they put the electrodes on, you can actually feel them contract and then expand back. For what type of patients is TENS unit contraindicated? Like, when would we not want to use this? It's not recommended for patients with heart disease and or cardiac pacemakers. Crutches. So you will be learning how to educate patient on crutches and gait. And when you fit the crutches properly, it should make it so the patient does not lean on the crutches, but they actually are using it to help ambulate. And we'll talk more about that. Make sure the patient bears weight on the hands, not the armpits. So a lot of times patients using crutches, if they're not taught correctly, they're leaning their weight through the armpits and doing the gait, and that's putting a lot of pressure on the body. Crutches are designed for you to actually bear the weight onto the hands, on the handles. You want to educate the patient on the safety rules regarding crutches and how to avoid injury. Report any numbness or tingling of the upper body or arms to the provider. This may indicate nerve damage from the axillary weight bearing. Again, if the patient is not using the crutch correctly and they're leaning under their armpits and that's the axillary weight bearing, then it can cause some nerve damage. And here you'll find this in figure 1920, and it goes over the 2-point gait, the 3-point gait, the swing through gait, and the 4-point gait. So please take some time in your notes to look at that and know the differences between the gaits. Here we see a walker, and walkers are used not only for geriatric or elderly, but also when some patients are recovering from orthopedic surgeries and different types of things. The top of the walker should be just below the patient's waist at the same height as the top of the hip bone. And you can see here, if you look, here's the hip bone, here's the top of the walker. So that looks pretty good. If the walker has been correctly adjusted to the patient's elbows will bend about 30 degrees while he or she uses the walker. So when they're walking back here, there should be about a 30-degree bend there. You want to instruct the patient on how to use the walker safely. Some of these things include making sure that when they go home that they remove any rugs and things that they might get caught up and slip on, as well as how to correctly use the walker and bear the weight. Patient guidelines are included in the textbook, and I want you to make sure that you look over that as well and take some good detailed notes. Canes. To fit a cane properly, have the patient stand up straight and measure the distance from the wrist crease to the floor. After you've done that, this is the total length of the cane, and it should be fitted to the patient. The patient's elbow should be bent to approximately 20 to 30 degrees if the cane has been correctly adjusted. Please, again, instruct the patient on how to use the cane care safely, and these guidelines are also found in the textbook. Please make sure to take some detailed notes. This is important. Wheelchairs. So wheelchairs provide mobility for those who cannot walk or can only walk short distances. With manual wheelchairs, patients uses their arm muscles for mobility, and with motorized wheelchairs, they can be controlled by the patient just through motorized movement instead of actually having to do the full